Hello, today I will explain about the retention stage, which is the stage after the orthodontic treatment, why it's important and why the teeth want always to go back to their original position. A lot of patients ask why we have to do orthodontic treatment for 1 or 2 years and after that we have to wear a retainer. I will explain this why, and we should know that the stage of retention is as important as the orthodontic treatment itself. The teeth are present in bone. Around the bone is the gingiva. The teeth are attached to bone and gingiva through ligaments. Those ligaments, they have a lot of vital and important functions for the teeth and for the sensation. We'll talk about this in other videos. So, these ligaments which attach the teeth to the bone and to the gingiva, they have a memory. They have a high stage of memory. This memory is the main factor responsible for the problem of teeth that want to go back to their original position. And for this reason, some schools from before, they're still doing it till now, is that after orthodontic treatment, they do a kind of minor surgery to cut those ligaments so that new ligaments are formed and new memory is formed. But this also didn't help 100% without a retainer. So the retainer is mandatory for the upper and lower arch, or for one arch if we're doing orthodontics in one arch only, and to the time period determined by the orthodontist. What are the types of retainers? In most of my cases, I like to place a fixed retainer in the lower jaw, and for the upper, according to the case, most of the cases we place a fixed retainer in the upper arch with a removable retainer. This fixed retainer in the upper arch can be permanent, can be for small period of time, according to the case itself. The other question, is the retainer enough that the teeth don't go back to the original position? The answer is no. During the orthodontic treatment, we take care for many factors to be accomplished at the end of the orthodontic treatment that will help retain the teeth and help the retainer in its function, because the retainer alone is not enough to, or in most of the cases it is not enough to handle the teeth, or at least the moment the retainer is broken or the patient is not putting the retainer, fast relapse will happen. Relapse is the process when the teeth start going back to their original position. What are these factors? We will talk also about them in another video. Please feel free to ask me any question. Thank you.